Hi, today I want to introduce you to the nervous system. I want to talk about the nervous system, neurology, and neuroscience. The nervous system is a complicated system. It's the most complicated and most responsible system of the whole body. Of course, it comes with its challenges. If the human brain were so simple that we could understand it, we would be so simple that we couldn't. That's why I think we have something called neurophobia. Neurophobia is the fear of neuroscience among medical students and physicians, and it's seen in 50% of the medical students or physicians. It's common all around the world. We have papers about describing neurophobia from Sri Lanka to Brazil to Saudi Arabia, from Egypt, from the United States. Almost everywhere, every country described neurophobia. But we have to overcome this neurophobia. We have to come over it because we know that emergency room admissions, at least before Corona, was 10 to 20% of all admissions were related to neurological disorders. So every physician and every medical student has to have a better understanding about neurology. Now, to cure neurophobia, we have to know what's causing it. And when you look into detail, when you ask physicians or medical students what their favorite subject is, the most favorite subject, no, it's not neurology, it's cardiology. The second favorite subject is endocrinology. And the third favorite subject is neurology. So neurology is among the top three favorite subjects during medical training. But then what happens? What happens that 50% of all students and all physicians get something what we call neurophobia. Now, when you ask the same group of people what was their most difficult rotation during medical training, 50% of students and 41% of physicians say that the most difficult rotation was neurology. Similarly, when you ask them about how confident they are dealing with different symptoms, we see that they are more confident dealing with shortness of breath, chest pain, fever, abdominal pain than they are with the neurological symptoms such as headache, dizziness, or numbness of feet. They feel less confident dealing with these symptoms. But why? Why? How does it come from the favorite top three, the third subject, to the most feared subject? What changes during the way and when? When I read all those papers, I came up with a few possible explanations. The first one is the need to know basic neuroanatomy. Nobody likes neuroanatomy. Nobody really likes anatomy unless it's taught in a very fun and very functional way, which can be done. So we have to change the way we teach neuroanatomy. We have to make it more clinically related. Our examination, the neurological examination, is a little bit more complicated than the other system examinations. It's a little bit more complex, and that's why most physicians, they rather consult a neurologist than doing the neurological exam themselves. But the main reason is poor teaching. They like the subject, they like the rotation, but they don't like the teaching. We're not teaching neurology the way we should be teaching it. So this is my lecture that I give to second-year medical students. This is how I introduce them to neurology. And this is the way I think we should teach neurology in medical schools. There are more than 1,000 disorders of the brain and the nervous system. And it's a very big network and it's a very complicated system. But we have to start somewhere. So we have to start with the central nervous system. The central nervous system is the brain and the spinal cord. But we also have to teach about the peripheral nervous system, which is the anterior horn, the roots, the plexus, the peripheral nerve, the neuromuscular junction, and the muscle. We also have to teach about the autonomic nervous system, which includes the sympathetic system, fight and flight response, or the parasympathetic system, rest and digest response. We have to teach about cranial nerves, and this is one of the most tough subjects during neurology committee. But we can teach it in a more fun way. We can teach it more clinically related way.
My love, you do me wrong.
This is how I start my cranial nerve lecture for third-year students.
So discourteously, for I have loved you for so long, delighting in your company. Olfactory nerve, special sensory, smell from each nasal cavity. Optic nerve allows us to see special sensory fibers as well. Oculomotor nerve does improve, fibers allowing your eye to move. Parasympathetics too, constricting your pupil, oh yeah. The trochlear has a one-track mind, superior oblique is all it could find. Trigeminal number 5 has 3 major branches, oh yeah. Ophthalmic division shows feeling from forehead to tip of nose, maxillary and chewing throws by mandibular skin of the jaw. The abducens is an underachiever, the lateral rectus is all it delivers. Facial, however, lets us forgive her 6 branches to animate face. Zymatic, temporal, and auricular, cervical, buccal, and mandibular. Don't forget taster like Ferris Bueller, you'll have to retake the whole course. Vestibulocochlear used to be called auditory, don't you see? Fibers are special sensory, allow you to balance and hear. Glossopharyngeal is the man, stylopharyngeus and parotid gland, sensing from tonsils to middle ear land and taste for the back of the tongue. The vagus nerve does everything, motor and sensing inferiorly. Motor to pharynx and that is key, and cardiac plexus to boot. Spinal accessory motor drivers, shrugging and pharynx for all imbibers. Hypoglossal got spinal fibers, and it gives your tongue motor skills. I know that this is my worst to date, you'll have to forgive me, it's getting late. But before you get too irate, remember I love you all. Green sleeves was my heart's delight, green sleeves was my heart of joy. Green sleeves was my heart of gold, and who but my lady, green sleeves.
Evet, fena bir açılış olmuyor diye düşünüyorum. So then we have to continue with the vascularization of the brain. We have to teach about the famous circular villi, and we have to teach about what happens if one of these vessels get occluded with a thrombi, or if they bleed and we get a bleeding of the brain, which causes a stroke. So we have to teach about the stroke syndromes, which can be weakness, numbness, headache, speech difficulties, loss of balance. We have to teach about neuropathology, like what happens in an Alzheimer patient's brain, what changes in the brain that causes a young artist like William to change his drawing. William was diagnosed with Alzheimer's disease in '96, and he continued to draw a self-portrait of him every year. And you can see the changes in his drawings that happens every year. And this is his last drawing before he died from Alzheimer's disease. We have to teach about the cerebral cortex. It's the top level of hierarchy in the central nervous system. We have to teach about the gray matter, the white matter. We have to teach about all these hills and valleys in the brain, which make the cortex, which increase the surface area of the cortex. We definitely have to teach about the dolphins and how they have more foldings in their brain and how they are very smart and that they're called non-human persons. And we have to talk about the evolutionary changes in the brain, in the cortex, that makes us human and ask us all these questions. We have to look a little bit more in detail in the cortex. In histology, that's what we will do. You'll find the neurons in the cortex, and you'll find the axons in the underlying subcortical white matter. And then we'll talk about the synapses, which the areas that the nerves talk to each other. And how they talk to each other is they use the neurotransmitters such as norepinephrine, serotonin, or GABA. So we'll talk about all the synapses, all the different kinds of synapses in neurophysiology and neurochemistry. And then we'll talk about the two different hemispheres of the brain. You know, our brain has two different parts, the left brain and the right brain. We'll talk about the specifics of those. And we'll talk about the right hemisphere, how it controls the left side, how the left hemisphere controls the right side of the body. We definitely have to talk about corpus callosum, which connects the two sides together. The right brain and the left brain are connected to each other with this subcortical, with this corpus callosum. And then we can give some examples about what happens if you cut the corpus callosum and the patient has a split brain, which is called split brain phenomenon. We have to talk about the left and right conflict. Like when you read these words, you can read them in a few seconds, but when you try to read the colors, it will take longer. Because when you're reading the words, your left hemisphere will make you read the letters, but when you read the colors, the right hemisphere will make you read the colors. And since in most of us, our left hemisphere is more dominant, when they fight together to read the words versus the colors, the words win. That's why we can read it faster, and that's called the left and right conflict. We have to talk about the different lobes in the brain. Different parts of the brain have different functions. The frontal lobe makes us move, makes us think. The occipital lobe makes us see. The temporal lobe is responsible for hearing and learning. The parietal lobe is responsible for touch. The cerebellum, balance and coordination, and of course the brainstem, the breathing, our consciousness, the heart rate, and our temperature. We have to talk about the motor cortex, and we have to talk about the big bed cells, the motor neurons in this motor cortex, because this cortex, this is the part of the brain that makes us move. We have to talk about the specific areas of the brain. This is a brain map from 1909. Brodmann described as 50 areas, and he said that every single area has a different function. But today, we're using so many different technologies, so many different radiological techniques, such as functional MRI, diffusion tractography, or even brain mapping. And now we know we have at least 180 different separate brain parts. We even map the brain during operations. And when a patient has a tumor in a risky brain area, we can even make the patient sing during the operation, that we make sure that the singing function is protected during the operation. And when there's a problem in his singing, we know we have to switch the operation in a different direction. Now, neuroscience has changed. We used to think that specific areas control specific functions. The Broca area was responsible for speech, and the Wernicke area was responsible for understanding. So if Broca goes, you can't speak. But now we know that's not the cause. Now we know that instead of this Broca and Wernicke themselves, the subcortical, the connections are more important. Even if you get damage in one of these areas, if these connections are intact, then you can regain function. So we changed our view. We used to think in a localizational point of view. One area has one function, but now we have a dynamic point of view. We know that this network is more important, and this brings us to the connectome. This is the connectome of a worm. He has 300 neurons and 7,000 connections. We have 100 billion neurons, and each of them have 10,000 connections. So we have a very more complicated connectome. We'll talk about that. We have to talk about that, and we have to talk about the Human Connectome Project. And we have to talk about how this connectome is different in every individual, that it's like a fingerprint. And of course, we have to talk about what would happen if we didn't have a brain.
I could while away the hours, conferring with the flowers, consulting with the rain. And my head I'd be scratching while my thoughts were busy hatching if I only had a brain.
Thank you for listening. Hope you enjoyed.
I'd unravel every riddle for any individual in trouble or in pain.
Bye.
With the thoughts you'd be thinking you could be another
Lincoln, if you only had a brain.
Oh, I could tell you why the ocean's near the shore. I could think of things